Today's presentation is about Zika virus. Zika virus is a mosquito-borne virus first identified in Uganda in 1947 in a rhesus macaque monkey. Infection in humans was evidenced in the 1950s in other African countries, followed by sporadic human infections across Africa and Asia in the 1960s to 1980s. Since 2007, outbreaks of this infection have been reported in many parts of the world. In most cases of Zika virus infections, people remain asymptomatic. In cases where disease manifests, symptoms typically start 3 to 14 days after infection, generally mild, including rash, fever, conjunctivitis, muscle and joint pain, malaise, and headache, lasting for 2 to 7 days. These symptoms are common to other viral infections, and therefore, the diagnosis of Zika virus requires laboratory confirmation. Complications of Zika virus infection include: number 1, congenital Zika syndrome. Zika virus infection during pregnancy can cause microcephaly and other congenital malformations, including limb contractures, high muscle tone, eye abnormalities, and hearing loss. Number 2, fetal loss, stillbirth, and preterm birth may also occur. Number 3, Guillain-Barré syndrome, neurological disorders in adolescents and adults may occur. Zika virus is primarily transmitted by the bite of infected Aedes aegypti mosquitoes. These mosquitoes usually bite during the day. Dengue, chikungunya, and urban yellow fever are also caused by these mosquitoes. Vertical transmission from mother to fetus during pregnancy is also a possibility. Other transmission routes include sexual contact, transfusion of blood and blood products, and through organ transplantation. Diagnosis depends upon the presence of symptoms and history of traveling in areas with Zika virus transmission or Aedes mosquito vectors. A diagnosis can only be confirmed by laboratory tests of blood or other body fluids for Zika virus. There is no specific treatment available for Zika virus infection yet. Symptomatic and supportive treatments such as bed rest, fluids with antipyretics and analgesics should be advised. Non-steroidal anti-inflammatory drugs should be avoided to prevent bleeding risk until dengue virus infection are ruled out. Pregnant women who develop symptoms of Zika virus infection living in areas with Zika transmission should seek urgent medical consultation. For prevention, there is no vaccine available for Zika virus. Protection against mosquito bites is the best method to avoid Zika virus infection. Elimination of mosquito breeding sites, including covering water storage containers, removing stagnant water, and cleaning up trash, are highly recommended. Community initiatives to reduce mosquito breeding sites. Use of larvicides and insecticides to reduce mosquito proliferation and disease spread by the health authorities. Awareness about risks of sexual transmission of Zika virus to prevent possible adverse pregnancy and fetal outcomes. Use of condoms for safer sex practice during pregnancy should be practiced. Thank you for listening. If you like the video, make sure to drop a like. Let me know if you have any suggestions in the comments below.